Hello, and welcome back to my channel. I'm a seasoned and certified medical microbiologist, Gwendolyn Halle, and I'm popularly known as the medical professional with a difference because I bring you knowledge like no other to your doorstep at the comfort of your living room. If you're a returning subscriber, this is me saying thank you and I love you. If you just stumbled on this channel, on this video, don't forget to subscribe, like, and share, and thank you for your love. Thank you for all your appreciations. Thank you for your comments. Thank you for sharing. And I love you. Let's roll in. Welcome back. Into this class, we are going to be talking about 10 danger signs in pregnancy. 10 danger signs in pregnancy. And number one is if the water breaks. Run to the toilet. Run to the toilet. Now, don't be mistaken. Because the baby is growing in the womb, it may actually put some pressure on the bladder. And this may cause the woman to leak, to leak out some urine. So be very certain that it's not urine you're passing out and you're thinking that your water broke. So you have to know the difference. And the texture of urine will be different from the texture of when the anointic fluid breaks. The anointic fluid has a different texture to urine, even the smell. So you need to be very vigilant with that, so do take note. The second point is severe nausea and vomiting and a high fever. When you get nauseated or you vomit to a point where you don't feel like eating, everything you eat you vomit, is a danger sign. Run to the clinic. Run to the clinic. The third sign is too weak to do anything at all, too weak to get out of bed. It's a serious danger sign. Now, I'd like to say this: pregnancy is not a disease. The fact that you're having this beautiful human growing in you doesn't mean that it's a disease. You can actually be active, go around doing one or two chores, and you'll get tired. You get tired easily because you're feeding two, you are breathing for two. In fact, it's weighing on your body. Your hormones are all over the place. Yeah, it takes a toll on your body, but that doesn't mean you wouldn't be able to get up and do some things for yourself. So if you're not able to get out of bed and do some stuff, know that it's a danger sign. The next point is severe swelling of the legs and the palms. Now, we know that when a woman is pregnant, she's going to have swelly feet and swelly palms, but you could reduce this swelling as well by lifting up your legs on a pillow. In fact, don't use a pillow on your head, but lie slanted. So this will be your legs and your head this way. This will actually reduce swelling. So if you are so swollen up, your body starts to swell, your feet start to swell, you can't wear any shoes, your body is just so swollen, please run and see your doctor. It's a danger sign in pregnancy. The next sign, which is very important, is when you notice that the movement of the baby in your body, the fetus, has reduced or has stopped. That means as from 1 month, 5 weeks, you should be able to start feeling some movement, some constant movement, once in a while. But if you notice that the baby doesn't move as it used to move, but some women, they notice that the baby moves when they eat or when they drink water or when they eat their favorite food, the baby will move around a bit or just kick. But if you notice that your baby is not moving at all, or the movements have reduced, they are no longer excited, when you drink water, when you eat, or, like the way they used to be, please run to the doctor. the baby may actually be dying in your womb, or the umbilical cord could actually be wrapped around the child's neck and actually squeezing life out of your baby. Now, the next point we have is breathing too fast or too slow, or breathing with difficulty. This is a danger sign in pregnancy. Now, I know that most women will have this beeping here, but I'm talking if a lady is just, or she's breathing too slow, too heavy, she's finding it very difficult to breathe too slow. It's very dangerous, because if you're breathing slowly, the baby doesn't get enough air and the baby may die. If you're breathing too fast, something's wrong. Now, if you're breathing too heavy, if you're struggling to breathe, that's another danger in pregnancy. The next point is abdominal pain. Severe abdominal pain. Now, don't minimize this, because, once in a while, a lady may have a movement, a kick from the baby. But if you have a pain in any area of your abdomen, please, it could indicate that it's a miscarriage you're having or an ectopic pregnancy. So don't take it hands down. It's better to go to the hospital and be told that there's nothing wrong than to lose your baby or to lose your life. I would like to say this. Pregnancy is a very delicate, sensitive time in a woman's life, because she could actually lose her life. It's a risk to carry another human in your body. Pregnancy is a very, very sensitive thing. Don't just think that, you can go around not doing your antenatals, not doing your checkup, not caring about your body, because your life is at risk as well. Now, the next point is severe headaches or blurred vision. If you notice that you're having intensive headaches and your vision is blurry, you can't see right sometimes, you are struggling to focus, run to the hospital. That's a danger sign in pregnancy. The next point is convulsion. This could actually be caused by preeclampsia or eclampsia. It could also be signs of malaria, meningitis, epilepsy. So this is very important. And I would like to say this. It is important that before a woman decides to get pregnant, she should do a series of tests to actually make sure that she will not infect the baby or put her life at risk. And even while she's pregnant, she has to be in good health. Don't expose yourself to certain diseases, any form of infections, malaria, any form, epilepsy, any form of tropical diseases that you can pick around. Take care of your health. Don't eat any kind of fruit, because you're trying to avoid or reduce the intake of any drugs, because taking drugs, even while you're pregnant, could affect your baby in long run. So when you find out that, do your yellow fever, make sure that you are not infected with all of that. And if you have an unwanted pregnancy, let's say you were not prepared for the pregnancy, in the first weeks or the first month that you find out that you're pregnant, do your test. Do a series of tests, because this child in your body may actually make the infection you're carrying worse, and you may die. You may have a stillbirth. You may actually lose your life. There are a lot of women who actually are carrying a baby till 9 months by the grace of God, or even not up to 9 months, and the baby passes away. The baby dies in their womb. And that's a serious infection. You could start having infections. You could get bacteria in your blood, septicemia, and go into septic shock and die. So this is not a joking matter. This is something you need to take very seriously. Now, the last point, which has 4 subtopics under, is vaginal bleeding. Vaginal bleeding is a number one danger sign in pregnancy. Now, there are a couple of reasons why a woman could bleed during pregnancy or why she may have spottings during pregnancy. You know, when we are talking about implantation, like when the fertilized egg moves into the uterus and implants itself on the walls of the uterus, yes, the lady is going to have light spotting, you know, some bleedings for a few days, and that will be it. And that will be for the first 3 weeks or less than 3 weeks of the pregnancy, or from when she's pregnant, just light spotting, and it's going to stop. But bear in mind, if after 2-3 weeks the bleeding still continues, run to your doctor. You're not supposed to be having any form of bleeding. Abnormal placenta, that is placenta previa. That is when the placenta covers the opening of the cervix. Now, the third reason why a woman will bleed during pregnancy or have a vaginal bleeding or spotting during pregnancy is placenta abruption. When the placenta that is supposed to connect the baby to the mother detaches itself from the womb, it prevents oxygen and nutrients from the mother from reaching the child. And this is called placenta abruption. Very dangerous. Now, the fourth reason why a woman could be bleeding or having during pregnancy or have a vaginal bleeding or a vaginal spotting during pregnancy is ectopic pregnancy. Ectopic pregnancy is very common. Very, very common. So watch out for it. And most times when this zygote or fetus begins to grow in the fallopian tube, if it's not noticed with time, it may grow to a certain extent where the lady will experience excruciating pain and she'll have to be rushed to the hospital, and that whole ovary and fallopian tube will be taken out, and the lady will just be left with one ovary and one fallopian tube. So it's a very, very dangerous sign. Another sign is miscarriage. A lady could be having a miscarriage, but there are so many reasons why a woman would have a miscarriage. So ladies, I want to encourage you to be very sensitive while you are pregnant. And also for men, be also sensitive to anything that may be wrong with your wife while she's pregnant. You know, it's always advisable that when a woman is pregnant, you always need to have emergency funds, emergency finances that you keep aside for any form of emergency that may arise during her pregnancy. Remember, the life of the baby is important. The life of your wife is very important. Don't joke with your life during pregnancy because you are at high risk, especially if you are both 40 years of age. Any pregnancy you have after 40 years of age is a high risk pregnancy. You know, pregnancy is a risk already on its own. When you have it later than 40 years of age, it's a high risk pregnancy. So do take care of yourselves, ladies. Till next time, I remain your seasoned and certified medical professional, Gwendolyn Hallen. Bye-bye.